Hi, everybody. Today we'll be focusing on the skeletal system. So we will be looking at the bones of the axial skeleton as well as the appendicular skeleton. So we have looked at some of this terminology before, but in this presentation, we're looking at a disarticulated skeleton, looking at each of the bones basically, and also we will be looking at some of the structures that are present on each bone. So it's not simply identifying the bone, but also identifying parts of the bone and the terminology as well. So looking at the distinction between your axial and appendicular skeleton, that basically forms your skeletal system. Axial skeleton, again, is kind of highlighted in that silverish color. It's your skull, your vertebral column, you have your sternum, as well as your ribs. So kind of going over that in a little bit more detail, you will have 12 pairs of ribs, and we go into the differentiation of what is a true rib versus a false rib versus a floating ribs later on. You also have categories of what we identify as vertebra. So we have 7 vertebrae associated with your cervical region. Cervical implies your neck region. You have 12 associated with your thoracic or your chest, basically, 5 with your lumbar or your back, 5 with your sacral, and then 5 for your coccygeal. For your appendicular skeleton, basically that's your shoulder and your pelvic girdle, as well as your upper limbs and your lower limbs. So your upper limb is made up of the humerus, radius, and ulna, and then your carpals, metacarpals, and phalanges. For your lower extremities, we have the tibia, fibula, your femur, your tarsals, metatarsals, and phalanges. For the connection point for your basically your upper extremities to the axial skeleton, you have your pectoral or shoulder girdle, which is made up of your clavicle and a scapula. And for your pelvic girdle, you have the 3-bone fusion structure called os cocci, which is made up of the bones ilium, ischium, and pubis. And again, I'm just introducing the terminology. We're going to go into a little bit more detail about each of these bones and learn some of the structures associated with each as well. So let's go ahead and get started with some of the vocabulary you may see. So you have the word process in terms of identifying structures on the bone. Processes identify in terms of projections from a structure, so basically an extension of the bone. You may hear the word foramen. These are basically holes that are found in the skull almost always. And then if the opening is more like a channel or basically digging into the bone, that's the word we use for it is meatus or canal. So the other one that I've not listed here, but you will see, is the word fossa. So I'm gonna add it here for you guys so you guys have an understanding of this. So fossa is basically going to be a kind of a flat surface where most of the muscles would sit through. So it's a wide, almost flat surface on the bone. And again, you'll see this as we go through these terminologies in just a minute. So let's go ahead and get started with your axial skeleton, basically with your skull. So this is a color-coded skull. We don't always have access to these bones, but it is a good way of introducing the bones. However, do keep in mind that in your exam, you might not actually have these beautiful colored image. However, based on the location of the bone, you should still be able to identify the correct bones. So what we have for our skull is we have the bone that is called the frontal bone. So that forms basically your forehead and then the front region of your skull. You have the parietal bone, which basically forms the majority of the dome of your cranium. And in the back, you have a bone called the occipital bone. On the side of your head, you have the temporal bone. So a lot of people refer to them as your temples, basically. Coming off of your temporal bone, you have two structures, this kind of bony protrusions called mastoid process. This is an actual structure that you can feel by really rubbing right behind your ear. You can feel a kind of a bump right behind your ear. That little bump is your mastoid process. And then you have another sharp extension coming off of your skull or your temporal bone called the styloid process. So make sure you guys can distinguish between these two. You have your cheekbone, which is identified as the zygomatic bone, and you can see that it is bridging with your temporal bone right here. You have the facial bone, which is your maxilla, and then your bones that basically forms your the curvature of your nose called the nasal bone. Now, looking at how these bones are actually connected together, these are using the sutures. The word suture should sound familiar to you. Is one of the type of joints we have. It is identified as an immovable joint. The suture that is found between the frontal and the parietal bone, so between your frontal and the parietal bone, is called the frontal suture. The suture that can be found between the parietal and the temporal bone, so this line right here, is called the esquamosal suture. The suture that is found between the occipital bone and your parietal bone is called the lambdoid suture. And lastly, the suture we have in this picture is the one that is connecting the mastoid process to the occipital bone. And literally the name of the suture is the combination of these two structures and bone. So it is called the occipital mastoid suture. Now, if you look at the top of your skull, which is depicted right here, you actually can see the two parietal bone that forms, again, majority of your cranium. So here is one parietal bone, here's another parietal bone. This is basically the top of your skull. So these two parietal bones are connected by this line right at the center, which is your sagittal suture. And here is your frontal suture, which again connects the frontal bone to the parietal bones. Now, if I go ahead and basically remove the frontal and the parietal bone, so I'm basically taking the top of the skull off and then I'm looking inside my skull, you will see the following structures. So you see a lot of holes or opening inside the skull. These are basically the openings that allow either nerves to exit the brain and go to different parts of the body, or these are the opening that allows the blood vessels to either enter or exit the skull. So let's take a look at some of these terminologies and openings. So you have this opening right here. So again, it's not really visible, but it's right here. There's one opening here and there's one opening here. If you kind of visualize this, this picture, I want to kind of help you. This is your frontal bone right here. So basically your eyes would be right here and right here. So your eyes basically collect data, correct? And then they send that data back into your brain for processing. So the nerve that actually collects the data is called the optic nerve. And for it to go from basically the eye into the skull, it needs to pass through an opening, and this opening is right here called the optic canal. So again, this is an opening where the optic nerve passes through. The other structures we have is actually three openings that are in order. So you have one, this one that looks like an oval shape, and another small hole. So 1, 2, 3, and again, these are in order. These are called foramen rotundum in order, foramen ovale because of its shape, and then foramen spinosum because it's kind of round. So these are the three openings, and again, the order and the names are foramen rotundum, foramen ovale, and foramen spinosum. Looking underneath the skull, which is also visible in this picture, you have this really wide opening right here at this skull. Kind of again, orienting yourself, this would be your occipital bone right here, and on the side right here would be your temporal bones. So this wide opening you see down here, this is where your spinal cord actually gets access or connects to your brain. So the wide opening that you have is referred to as the foramen magnum, which is depicted right here from the outer view. You also, if you look at your skull from the side view, you have an opening right here. So kind of visualize this, guys. Here's my mastoid process. Right above my mastoid process, I have this opening right here. This is basically your ear canal from the skull point of view. So you have your ear, your outer ear, sitting on top of this opening in the skull. And this is referred to as external, as an outside, acoustic, as in sound, meatus, which means canal. You can replace the word acoustic with the word auditory if you wish. Now you also have your jawbone, and that is referred to as the mandible, so right here. Now what do you need to know about mandible is some additional terminology. You have this region right here, so you have this kind of two processes or extensions. You have one here and then one more anterior. This is the one that actually fits into the skull. So if I kind of backtrack to the previous picture, notice this extension right here. So this is your extension 1, and this is extension 2. So in this picture, here is 1 where it's fitting into the skull, and here is your number 2. So this one that actually fits into your skull is called the mandibular condyle, and the more anterior one is called the coronoid process. You also have these extensions this side of the mandible called the mandibular ramus. I haven't added this, but I think it's kind of cool for you guys to also visualize. You have this kind of an angle right here that basically forms on the mandible, and it is literally called mandibular angle. Now, in both maxilla and mandible, there is these little bumps where your teeth are fitting into your gum line or your jawbone. These little bumps that you see that are formed, and you can actually also feel them on the surface of your gum line, are referred to as the alveolar margin. Now, even though I only depict it for your mandible, please do note that the same structure is also present on your maxilla. Now, in terms of the sinuses, so you all have heard of sinuses. The proper terminology is paranasal sinuses. These sinuses are associated with your respiratory system, and they're also present in terms of the structures identified on your skull. These are these cavities that have mucus lining. There are 4 sets of them. You have ones that are built into your forehead. These are associated with the frontal bone, so they're called the frontal sinus. Right below that, you have these structures right here, which is associated with your ethmoid bone, which literally sits right there. And therefore, these are referred to as ethmoidal sinus. There is another bone that sits right below that. It's a butterfly-shaped bone called the sphenoid bone. It's a relatively large bone. And again, this opening associated with that is referred to as a sphenoidal sinus. And lastly, you have these really large sinuses on either side of your maxilla. They're referred to as the maxillary sinus. So those are all the terminology I need you guys to know for the skull. So moving on, the next structure we have is the vertebrae that form your vertebral column. Now, the structure of these vertebrae are different when we compare the cervical to the thoracic to your lumbar region, etc. But most of these will have the following structure as visible structures. Now again, they're going to be different in terms of sizes, but their structures are going to be visible when you compare, let's say, the thoracic one to the lumbar region. So first part that you have is this kind of bony structure, this really large structure that's called the vertebral body. And then you have these extensions that are coming off. There are actually 3 pairs of processes and then 1 single process. So you have a total of 7 processes on a vertebra. You have the ones that are coming right from the top, so they're kind of pointing upward, and these are referred to as the superior process. Kind of logical, superior means on top, right? You have ones that are sticking out, so kind of think about your little ears popping out on either side, right? So these are referred to as the transverse process. And then lastly, you have the ones that are coming from the bottom, and these are referred to as the inferior process. Again, even though it is kind of hard to visualize in this picture, please do note that there are 2 superior process, 2 transverse process, and 2 inferior process. To kind of show you here, I'm going to kind of highlight these. Here are my 2 superior, kind of helping you visualize. Here are my 2 transverse, and then here are my 2 inferior process. Lastly, you have the single processes that extends right on the back. That's referred to as the spinous process. If you have ever looked at your back and you can kind of feel those little circles that runs right on your back. When we were kids, I used to count them and kind of feel good. These are basically what you're counting, your spinous process for each of the vertebra. Now we learned that the vertebrae are within the cervical region, between the thoracic and the lumbar region. So the point of attachment, where the vertebral column basically fits into the skull, there's the 2 top vertebrae that are associated with the cervical vertebra that have their own particular name. These 2 are really important because they give you the rotational movement of your head. They are called atlas and axis. So atlas is literally the first vertebra that connects to the skull, and sometimes it's referred to as C1 or C1 or cervical 1. But this is the name I want you guys to know, atlas. So I will not accept these 2. I'm just kind of telling you the position, but it's not the actual name. And then axis, which is the second one, it connects to your atlas. And basically, when these 2 fit into each other, that allows the rotation of the head. Now notice that the axis has this little pointy thing sticking out. This little pointy thing sticking out is what fits right here. And basically, again, allows the axis and the atlas to rotate on each other. This little pokey part of the axis is referred to as the dens. Now, moving up, some of the structures associated with your thoracic region, you have your clavicle. Some people refer to this as the collarbone. You have the sternum, and then you have your scapula, which is a point of attachment between the axial and appendicular skeleton. Now, when I take a look at the sternum, if I ask you to name this bone, the name of the bone is the sternum. However, a sternum broken down to 3 parts or structures. The more wide region that is superior, called the manubrium, the midsection, which is called the body, and this little ending point, which is actually cartilage, called xiphoid process. So if I'm asking you for the structure, I'm asking you from one of these 3 names. If I'm asking you for the name of the bone, then your answer would be sternum. Looking at the scapula, what I'm showing you here in this picture is a posterior view of the scapula. So what you see right here, this bony protrusion that you see, which we call the spine, is the one you can actually feel when you move your shoulder. So when you move your shoulder and you see those little bones poking out, what is actually poking up is the spine. Now, spine literally divides the posterior aspect of the scapula to two parts. The part that sits above the spine, which is the smaller part, and this large piece that sits below the spine. So the top part is called supraspinous process. Again, supra as on top, superior, spinous as on a spine, fossa as on surface. The supraspinous process. And this surface that sits below is called the infraspinous process. Infra comes from the word inferior. If you turn around your scapula and look at the anterior surface of the scapula, there are no spines. There's just a big flat surface. And this big flat surface is called the subscapular fossa. You also have this structure right here. This is, imagine, where the humerus will be attached. So here is basically, if you kind of imagine it, here is my humerus attaching to it. The point of attachment is kind of indentation in your scapula called the glenoid fossa. Now, when it comes to your ribs, I don't really need you guys to say, here is my rib, basically. What I do want you to be able to identify is the classification of the ribs that I mentioned at the beginning of this PowerPoint. So there's three main categories of ribs. These are called true ribs, false ribs, and floating ribs. So rib 1 through 7, and you can count them yourself, have the rib, have the cartilage, which you see in blue color, and that is a direct point of attachment to your sternum. Again, let's take a look at another one. So this is rib 3. So you have your rib, you have a cartilage for itself, and then that connects to your sternum. Because they have a 1-to-1 ratio, basically one bone, one cartilage to the sternum, they are identified as true ribs. Rib 8 through 12 either completely lack the cartilage, or their cartilages for multiple ribs are going to overlap with each other to form one cartilage. So let's take a look. Here is my ribs 1, 2, and 3. Notice how their cartilage are all merging together to form one cartilage here, which comes into my sternum. So therefore, these are identified as false ribs. Interestingly, your last two pairs of ribs, which is number 11 and 12, they don't even have the cartilage, they don't come around your rib cage, and they're basically much smaller than your typical ribs. These are identified as floating ribs. If you're interested, you can do a Google search on this individual that really wanted a narrow waist, and they ended up removing their pair of rib number 12 to basically give them a thinner waistline. Yeah, and yes, that was true. Now, the last part of your vertebral column is connected to the sternum, and the sternum, sorry, not sternum, I apologize, sacrum, and sacrum is connected to coccyx. A lot of people may refer to the coccyx as the tailbone. Please do remember that the proper terminology is coccyx. On the surface of the sacrum, you have these little holes or openings. These are referred to as the sacral foramen. So again, if I ask you for the name of the bone is sacrum, and the little opening on the sides of it would be sacral foramen, which are the structures on the bone. Now let's take a look at your upper limbs. So upper limbs has three main bones, your humerus, ulna, and radius. So they are depicted here. Couple of ways to characterize them. Humerus has this beautiful kind of round end. This is the point that basically fits into the glenoid fossa of the scapula and give you the rotational movement of your arm. You have ulna and radius. Please do keep in mind that radius runs on the side of your thumb and ulna runs on the side of your pinky. So these two bones, when your hand is in a supine position, they are parallel to each other, with radius running again on the side of your thumb and ulna running on the side of your pinky. But how do I identify these two bones? If I look at the ulna, this is how I identify it. You're more than welcome to come up with your own characteristics. If you look at the end of the ulna, do you see this kind of the curvature right here? It forms a U. So ulna starts with a U, so it's easy to remember. Now, this bone right here, this curvature, actually fits into the end of your humerus and forms your elbow. So the bone that it basically pokes out when you bend your elbow, this is the bone. This is a part of the bone that is forming the elbow, the sharp point of the elbow. The radius, if you look at the end of the radius, is actually made up of a circle. Like literally, it's a circle. So if I'm looking at it from the superior view, it has a circle. This circle has a radius, hence the name radius. So that's another easy way for you guys to remember the terminology. Now, if you look at the either end of the ulna or radius, which is basically the distal end, when it connects to your wrist bones, you see these two small projections, one right here, one right here. These are sharp projections, and these are referred to as the styloid process. Kind of the same terminology of the styloid process, which was that sharp piece of bone that was sticking out of the side of the skull by the mastoid process. Taking a closer look at the humerus, if I'm looking at the humerus from the superior view, basically, again, this is the location where it's fitting into my glenoid fossa of the scapula. What I would see, and again, here's the head, kind of visualizing it for you. Here's my head. I see two bumps, one big one and a smaller one. So here is the different view, one big one and one smaller one. So kind of numbering for you. Here is my head in this picture. Here's the head on this view. Here is the smaller of the two. Sorry, I'm going to put number 2. So here's the smaller number 2. And then the larger of the structure is what we see here. So again, that big curvature is the head. The smaller structure is called the lesser tubercle. And the bigger the bigger structure or protrusion is called the greater tubercle. If you're wondering what does the word tubercle imply, tubercle means basically points of attachment for the muscles. So these are really important in terms of attachment of the muscle to the skeletal system. Now, right below your head, you have basically the neck of your humerus, so it's referred to as the surgical neck. So you don't see the S, but the full name is surgical neck. Again, here is how these three bones connect together. You have your humerus. If you can imagine, your scapula would be connecting right about here. So here's my scapula. And again, that forms your glenoid fossa right here. Here's my humerus. Radius, again, and ulna are parallel to each other. Radius is running on the side of your thumb, and ulna runs on the side of your pinky. And the sharpness of the elbow comes from the ulna. Now, moving down basically your arm, you reach your hand. So you have your wrist bones, and there's a total of 8 bones in your wrist, which as a whole referred to as carpals. For this level, I don't expect you guys to remember the name of the 8 bones, so you can literally just call them the carpal. Please do not call them your wrist bones. The bones that forms your palm of your hand are referred to as metacarpal. When you name these, make sure you guys remember that your bone that forms are associated with your thumb is number 1. And basically you work all the way to your pinky to get to number 5. Now, when we're looking at your fingers, all of the bones associated with your fingers, including your thumb, are referred to as phalanges. Now, phalanges, with the exception of your thumb, have 3 bones. So here again, 1, 2, 3, 1, 2, 3, 1, 2, 3, 1, 2, 3. But for your thumb, you only have 2. So if I put basically this giant circle and said, what are these bones as a whole called? Your answer would be phalanges. However, when we ask to name the individual bones within your fingers, or basically your finger bones, the name gets a little bit more complicated. So make sure you guys remember the order. So the bones that form the finger, the tips of your finger, are the farthest away from your points of attachment, so they're called distal. You have the bones in the middle, and then the one closest to your points of attachment, that's your proximal bone. Your thumb, since it only has 2 bones, it has proximal and distal. I tell my students, remember, if you have 2 kids, you won't have a middle kid, right? You have either the first kid and the last kid. That's it. There's no middle kid. So how do I name each of these bones? Here's the way that you name it. You name it based on the location, distal, middle, or proximal. Use the word phalanx, which basically means finger bones, and identify the digit. So again, if this is metacarpal number 1, then these would be associated with finger 1, finger 2, 3, 4, and pinky would be your number 5. So I have this kind of orange circle right here. So the orange one basically would be the bone in the middle, so it's called the middle phalanx, and it's associated with your 5th digit. This one would be your distal phalanx in blue, and it's associated with your 1st digit. If I circle this one, then your answer would be distal phalanx, 4th digit. Now, I am going to let you know right now that the terminology we use for your fingers and your toes are identical. The bones that you find in your fingers and your toes are all 3 bones, same concept, distal, middle, proximal. The exception in both fingers and toes are your big toe and your thumb. They both have only 2 bones, and therefore they will have proximal and distal only. There wouldn't be any middle bone. You have, moving down to your lower limb, you have your pelvic girdle. Now, pelvic girdle bone, right here by itself, is referred to as the os coxa. So I'm just showing you one right here. If you bring them together, this is what it looks like. So here is one bone on this side. Here is the second one right here. And what you see in the middle section of this is the triangular bone we identify as your sacrum. So again, kind of helping you imagine this since you don't actually see the bone here. The ilium, which is the top portion of the bone, is right here. So here are your iliums on the top. What it's sitting on is the ischium that's back here, or ischium, depending how you say it. That's the second bone. And this bone right here, where you see it connected right here, bringing these 2 bones together, is this bone right here, which is your pubic bone right here and right here. Please do note that basically when you bring your whole pelvic girdle together, you create this central opening right here. So if you are a female, this is basically would be the birth canal. So when you're comparing a female opening or pelvic brim, what is called pelvic brim, between male and female, the women pelvic brim, and I'll show you guys in a drawing, the female pelvic brim would be more oval shaped. And again, this is basically going to be used for the passing of the baby's shoulder. And if you compare this opening in male, it would be more round. You also have this arch right here. So in female, because it's more oval, the arch is more open. But if you compare it to males, the male arch would be more closed. So it would be the male arch versus, again, female arch. So this is my female in terms of the brim, female, bigger arch or wider arch. This is our male brim. It would be more round. And this would be a sharper angle for male. So I always tell my students, if you kind of imagine like the 18th, 19th century, when women would wear these kind of clothing and these wiring underneath their clothing that accentuates their hips, basically was a sign that they will be childbearing women, or they have a higher chance of carrying it and giving birth to a healthy child. Now, was there any truth to it? Who knows? Now moving down, the next set of bones that we have are basically bones that form your lower limb. You have this really long bone, which is one of it is the largest bone we have in our body, called the femur. That's your thigh bone. And what you see here as these kind of beautiful round structure fits into our os coxa and basically gives you the rotational movement of the hip. You also have two other bones. You have tibia. This bone is the thicker bone. I always tell my students, this is the one you hit on a table. So this part of the bone is what you hit on the table if you ever hit your lower leg. This bone is the medial bone. On the side of the leg, on the lateral aspect of the leg, you have the more skinny or thinner bone, which is your fibula. Please, there is no bone called fibia. There is no bone called tibula. Your options are tibia and fibula. So please be careful with the words. So fibula, because it's, and this is how I remember it, is thinner. So it's more susceptible to fractures. So F for F, fractures, fibula. Now the ends of your fibula and your tibia, they are again similar to what I described. There are these extensions, kind of this sharpness to the bone. The fibula, because it's lateral, the extension is called lateral malleolus. Tibia, because it's the medial bone, that extension is the medial malleolus. What does this look like on actual your body? There are the two little bony parts that is poking out on either side of your ankle. So if you're looking at the inside of your ankle, that pronounced structure comes from the medial malleolus. And if you're looking at the outer little ball that is sticking out on the side of your ankle, that's your lateral malleolus. Now moving back to the femur, again, this part is the region that fits beautifully into your os coxa, so that's your part one, and I'm kind of going back and forth and labeling this for you. This region in the middle, this area right here, I'm going to kind of highlight this. This is number 2, which is the neck right here. And like humerus, you basically have these kind of 2 big protrusions. Here's my big one, here's my smaller one. The big one's called the greater trochanter, and the smaller one is called the lesser trochanter. So greater trochanter, here is my greater trochanter. You can see the size is larger. And again, lesser trochanter here is number 4 for us. Trochanters and tubercles are both points of attachments for your muscles to the bone. You also have your kneecap. So the kneecap is actually relatively a small bone. It is referred to as patella, and it has this kind of a circular shape to it. It does have a pointy part to it. So this pointy, kind of like what we learn about the heart, is referred to as the apex, and the top of the patella is referred to as the base, where it is more flat. Now, when we're talking about your the bones of your ankle, you have what we identify as tarsal as a category. Again, these bones have their own name. They're total of 7. You are not required to know those names. Just identify the general group as tarsals. The bones that forms the sole of your foot are called metatarsals, and the bones for your toes are referred to as phalanges. As I mentioned earlier in the PowerPoint, the terminology for identifying each of your phalanx are identical to what we described for the fingers, so I'm not going to repeat myself. One last point that I want to make is the fact that your naming or numbering also starts with your big toe in this case, metatarsal 1, and your pinky would be number 5. And the same concept applies to your phalanges. So that's it. We will continue the following lab with the muscular system.